Angie Nichols from Tier 1 Health and Wellness. Thank you for joining me this afternoon. And today I would like to talk to you about menopause and how do you know if you are in menopause. Menopause is defined as no menstrual cycle for 1 year. In patients that have had an ablation or partial hysterectomy and are no longer having cycles because of that, then we have to then look at an FSH and LH test. And it's a simple blood test that can be done. Menopause occurs between the ages of 45 and 55, with the average age of being 51 in the United States. Other symptoms of menopause are hot flashes, night sweats, vaginal dryness. You also start to notice a redistribution in body weight, and fat begins to shift from the hips, thighs, and buttocks to the abdomen. And there's also a loss of muscle mass that occurs. Usually, hot flashes and night sweats are the first symptoms of menopause. So if you haven't had a menstrual cycle in 1 year, or if you've had a uterine ablation or partial hysterectomy and are experiencing some of these symptoms, you should consult with your physician to determine whether or not you are in menopause so that you can get adequate treatment, which will help preserve and protect your health in the years to come.